So I am still hearing some buzzing, but we're going to get started here, and I will try not to be too distracted by what's happening on my computer screen. But I would like to say welcome to everyone, and thank you for joining us tonight for our Reopening of Schools family webinar. This is for our OCM BOCES STARS Alternative High School, our Alternative to Homebound, and our Futures programs. All of which are part of our Innovative Ed department here at OCM BOCES. As we look to return to school in the coming weeks, this session is really designed to provide you with the most up-to-date information on our reopening of schools. So we're conducting this session remotely, obviously, through Zoom webinar. And in a moment, we'll discuss the features of Zoom webinar. But before I do that, I would like to introduce your panelists this evening. So my name is Eric Comtois. I am the Director of CTE and Innovative Education here at OCM BOCES. And now I'll allow our other panelist to introduce herself.
I'm Emily Behan. I'm the principal of STARS, and I am also working with Renee Montroy, assistant principal for Futures and Alternative to Homebound.
Great. Thanks, Emily. As we go through our reopening plans, we'll be taking turns in the presentation, kind of describing the different aspects of our reopening plan, and then at the end we'll be having some time to answer any questions that you might have. So a little bit about Zoom webinar and its features if you are not familiar with it. First, our webinar time is from 5 to 6 p.m. We're going to do our best to respect those start and end times. And if we don't have a lot of questions, we may get out a little bit early. I know it's a beautiful night here in Central New York, so we do appreciate you logging on. As questions come up, we encourage you, or comments, to write them in the Q&A section at the bottom of your screen. So there's a feature at the very bottom that says Q&A. What you'll be able to do is click on that Q&A and type in any questions you may have. Those questions will only go to our panelists, so they will only be seen by Emily and myself. At any time, if you are unable to hear or see us, please put that in the Q&A and we'll try to fix that. But just know that you are not able to see any of the other participants and they're not able to see you or read anything. So we'll go over our agenda for this evening. The first thing that we'll do is I will review the OCM BOCES school reopening plan that you may have already seen through communications that we've had in the past several weeks. We know that health and safety procedures are on your mind, so that's really at the forefront of our presentation, talking about health and safety procedures that will be in place as we look to reopen our schools. We'll discuss classroom arrangements and procedures. We'll discuss what students can expect. So what is different since the last time they stepped into schools? We'll talk about what you can do to help best support your child in preparing for reopening. We'll talk about our instructional practices and what that would look like for either our in-person or remote instruction options. And then at the end, as I mentioned, we will have time for questions and answers. So on this screen, you can see the cover of our reopening plan. So every school district in the state had to submit plans for reopening. So this is a copy of the plan that we submitted to New York State for approval. So if you click on this link here, or you go right to our OCM BOCES website, there is a link directing you to our reopening plan. On this page, you can see links to the parent webinar that are happening across the organization this week. There's information around testing and contact tracing, remote learning. Our actual reopening plan itself is here, and it's 50-some pages. So if you know, we don't get into detail and you want to know something more about the reopening plan and a particular component of it, you are free to go on there and navigate through our reopening plan. Then there's some other examples that we'll be showing within our presentation tonight that are also available on our website. So this is really a great resource and I encourage you to look through it as you are able. So as we get back into our presentation here, we'll look at the different components that go into that reopening plan, starting with communication and community engagement, which is part of what we're doing here tonight. We find it really important to get feedback and get the most up-to-date information to all of our stakeholders, which includes you as family and students. Of course, health and safety will be covered tonight. We'll talk about facilities and all of these other items that we're not going to go over, but really do play a big role in planning for reopening school, including our school schedules, the social emotional well-being of our students, teaching and learning, special education, and attendance. All of those go into the reopening plan, and we will touch on tonight. It is important to note here at the bottom that all OCM BOCES student programs, and we're very excited to be able to offer this, are offered in person 5 days per week. And of course, we're in compliance with the CDC and the Department of Health guidelines in order to be able to do so. So a lot of planning and assessing of our space went into making sure that we are able to meet all needs of our students and our staff. We are also offering an all remote option for students as well, in addition to the 5-day in person. So the first item that we're going to discuss as it relates to the reopening of schools is health and safety. So obviously this is a large consideration when we're welcoming our students and staff back into the program. So the first kind of topic that we'll cover are protocols for cleaning. So in addition, during a normal school day, we have a normal routine cleaning, right? But we understand that coming back, into the schools during this time is a little bit different. So high touch areas will be cleaned multiple times per day. So you think of what those high touch areas would be. Those would be the doorknobs, desk surfaces, any tables. Those would be the areas that students or staff would touch most. So those will be cleaned multiple times per day. All of the cleaning products that we are using are approved by the CDC and the EPA for COVID-19. Our organization has purchased several Clorox 360 sprayers. You may have seen those, and basically what that does is it puts out a fog within the room and disinfects the space. Bathrooms will be cleaned at least 3 times per day. So when we think about areas that are used most and that have the potential for spread of germs, bathroom being one of those will be cleaned several times during the day. Continuing with our health and safety procedure, as an organization, we have decided that daily temperature screenings will be administered to all students upon arrival. So students will be screened when they come to school, when they arrive at school. You will still be responsible for evaluating your child's health in accordance with your component school district. So they may have an app, they may have a questionnaire, they may have a self-reporting tool that they're using. So our temperature screening would be in addition to that evaluation that is being done at your home school. Also, information or materials regarding COVID-19 symptoms are being developed, and those will be sent home. So those are designed to help educate our families and our students on the symptoms of COVID-19 and what to do if you are experiencing those symptoms. Health and safety videos will also be made available to talk about what school will look like, what you can do to help best prevent the spread of germs. Continuing here with our procedures, a student or staff member exhibiting those symptoms, and if you would like to see a list of those symptoms, if you access our school reopening plan on our website, you can see a list of symptoms that would fall under this category. So if a student or staff member is exhibiting a symptom during the school day, they will be sent to our health office for an assessment by the school nurse. And our protocol states, and again, all of this is guided by the health department and CDC guidelines, that any staff or student, the temperature of 100 degrees or greater should not be present in school. Additionally, screening questionnaires will be used to determine if an individual has experienced symptoms in the past several weeks, been exposed to or tested positive for COVID-19, or traveled to a location on the travel advisory list. So any guests or visitors to our school will be asked to complete these screening questionnaires before entering the building. And of course, we're trying to limit the number of visitors to those who are in our school. Parents of students exhibiting COVID-19 symptoms will be contacted. So if your child goes to the school nurse and they are in fact exhibiting symptoms consistent with COVID-19, you will be contacted to pick up your child and instructed to contact your healthcare provider immediately. This is very important to note that it's important that we have the most accurate and up-to-date contact information on file, so that in the event that we do have to contact you, you would be available, or someone in your family or on the contact list would be available to come pick up your child immediately. And it's really important that if you receive one of those phone calls, you have a way to get your child picked up in a timely fashion, and that's for their own safety and the safety of others. So a child who exhibits COVID-19 symptoms must be seen by a healthcare provider who will determine if a COVID-19 test is necessary. So once again, if your child is assessed by the school nurse and they are showing symptoms, that child must be seen by a healthcare. The healthcare provider may say a test is not necessary, but in order to return to school after showing symptoms, a student must have no fever without the use of fever-reducing medicine and must have felt well for 24 hours, and the student will need that doctor's note releasing the student to return to school. In the event that a student tests positive for COVID-19, we will follow these procedures. The student will stay home for at least 10 days since the first symptoms were present. It's been at least 3 days since the student had a fever without fever-reducing medicine. And it's been at least 3 days since the student's symptoms have improved, including cough and shortness of breath. And finally, an order of release from the health department since that child had tested positive. This process here kind of talks about the contact tracing process that is occurring in Onondaga County. So if there is a confirmed case of a student in our program, we work directly with the Department of Health on contact tracing and decision-making around the school. So the contact tracer is based on interviews and identifies who needs to be issued a 14-day quarantine. This is important to note that even if the person who was issued the 14-day quarantine tests negative, that person will need to complete the 14-day quarantine. On a different note, the Onondaga County Health Department has said they're providing mobile testing sites at different districts around Onondaga County. So you may have seen that in the news in the past week or so. And this is so that staff and high school students who want to get tested for COVID-19 before the school year starts are able to do so. This testing would be voluntary. And also we have received word that the Onondaga County Health Department has indicated they will conduct surveillance testing at various schools around Onondaga County. If you've not heard of this, basically surveillance testing involves a saliva sample by collecting a swab from a person's mouth. And then surveillance testing would then go on to involve taking those samples from 12 people, referred to as pool testing, putting them together and conducting tests to see if COVID-19 is present in any of those samples. If there is a positive test from this pool testing, it would be requested that the 12 individuals then get a diagnostic individualized test. So this allows the health department to determine if COVID-19 is present in a larger group of people. Surveillance testing would not be completed in schools or with students without parent permission. Continuing on here and talking about personal protective equipment, obviously, things have changed and there's the need to have more equipment on hand for students and for our staff. So protocols involving face covering. So approved masks must cover the nose and the mouth. And the school is required to have masks available for those who do not have them. So for any students who or staff do not have face covering, they would be provided one by the school. We're going to be discussing more expectations around wearing masks in the upcoming slides. Cleaning and sanitizing supplies, including disinfecting wipes and cleaners, will be present in all of our school spaces, whether it's in the classroom or in some of our more common areas. Additionally, hand sanitizer will be available in all of our instructional spaces. Students will be educated and encouraged to regularly use proper hand washing, hygiene, and respiratory hygiene. So really, at the beginning of the year, we're going to focus with our students on educating them why these new procedures. Finally, OCM BOCES has and will continue to make available educational resources that will support and promote health and safety in our schools. This includes new signs that we have developed, we've created, we have access to, and they are already starting to be put up around our building. So these are some examples of the signs that you might see around our building, around the entrances and the hallways and in the classrooms. The first example here guides guests to register and visit the reception area to immediately complete a COVID-19 questionnaire at the reception desk. Also, we'll be talking about properly storing and discarding personal protective equipment, washing our hands as frequently as possible, and when you can't wash your hands, using hand sanitizer, Of course, we have the expectation of social distancing by staying 6 feet apart at all times when in the school building. Additionally, we'll be educating students on the best ways to avoid the spread of germs in school and wearing masks at all times when moving throughout our buildings. Thinking about what might look different in our classroom spaces, students will have individual workspaces, and you can see that noted here in the picture, the screen, distanced by 6 feet. So we've done a lot of work in measuring all of our classrooms to see what the capacity is, and then moving furniture and aligning our classrooms to best meet safety protocols. I had mentioned more about masks was coming, so students and staff must wear a face cover or mask in all school settings at all times. Mask breaks will be provided when eating and drinking, but they have to be appropriate and on a limited basis. So students or staff would have to maintain the 6-foot distancing in order to have a mask break. The mask break would be at the direction of an adult, whether that be a teacher or an assistant or an administrator in the building. Also, when possible, hallways have been reconfigured to allow for safer flow in one direction of traffic. School sanitization has been a large consideration. So as we mentioned earlier, custodial staff will disinfect and sanitize each area daily. Hand sanitizer will be available and hand washing will be encouraged. So hand sanitizer will be available in every classroom space or area where students would be touching furniture. Staff will have access to the disinfecting supplies to use between classes. So if students are switching classes and a new group is coming in, staff will have access to the supplies needed in order to sanitize the classroom. Additionally, drinking fountains have been covered, but if your child would like to bring in a water bottle, they can do that. We just ask that those water bottles are labeled, but they will be able to fill those using filling stations. At this time, I am going to turn it over to Mrs. Bean to continue. Before I do that, I just want to remind you at the bottom of our screen is the Q&A feature. So if there's anything that I cover or Ms. Bean covers and you'd like more clarification or you have further questions, please type it in the Q&A. And while Ms. Bean is covering the rest of our presentation, I will be monitoring Q&A. So thank you very much.
Thanks, Eric. I'm going to be talking a little bit about how to help prepare our children to come back to school. So as a parent too, preparing our children, just being positive and reassuring how we approach it will impact how our children approach it. Being open to those new rules that we have, including wearing masks, social distancing, just to be able to kind of reinforce that so that it's something that the kids have thought about before coming back to school, possibly practicing wearing a mask for extended periods of time. I know we're doing that at our home with our high schooler and middle schooler because it's something new to keep a mask on for up to 3 to 4 hours with just short breaks that are directed again by the teacher or another adult in the building. And reinforcing hand hygiene, hand washing, use of sanitizer, just at every opportunity, just to be as safe as we possibly can and to stay as healthy as we can. Again, reinforcing the mask expectations would really, go a long ways, covering the mouth and the nose, increasing the length of time. Mask breaks would be during lunch period when they're eating breakfast, taking a drink, and again, at the direction of a teacher. We are working really hard to limit our transitions during the school day so that there's not an excessive amount of passing each other in the hallways, one way if we're at all able to do so. This is an example of traffic pattern in a hallway. This is just going one way in either direction so that students are socially distanced, and the arrows indicate 6 feet apart, one way on either side of the hall, and we will continue to share and discuss provided resources as we have them also so that you're able to use them and to go over them with your child. This is another example of a classroom at STARS, showing an arrangement of furniture that's been socially distanced, everyone facing in the same direction. We've worked hard to maximize our space. Hand sanitizers provided again in every room. No sharing of supplies. We are, working on ways to provide supplies that the students would keep with themselves. Students would be assigned a Chromebook so that they would not be sharing those. Windows open whenever possible to provide additional ventilation. And what students can expect in instructional practices. So what's different? Breakfast and lunch will be provided at school and will be eaten in individual classrooms. Arrival and dismissal staggered to practice social distancing and allow for the temperature screening. Whenever possible, we will be limiting transitions within the building space. Visitors to buildings, again, will be limited to those who are, need to be in the building. The student cohort model, whenever possible, teachers will move classrooms instead of the students in order to avoid more transitions. Physical education classes, when possible, weather permitting, will be conducted outside. When we are in the gymnasium, students, per the CDC guidelines, will be distanced 12 feet apart. For in-person learning, students and staff will adhere to social distancing at all times, practicing that within the classroom, within the common areas, in the hallways, anywhere where, we're within distance of each other. We will be educating students on instructional technology and using it daily in the classroom so that in the event of a closure, it will be a smooth transition. We will be using here at STARS and at Futures and alternative to Homebound, Google Classroom, as well as other digital platforms. Students will use individual devices throughout the day, Chromebooks in our case. The instructional objectives for in-person instruction will mirror those for remote instruction so that we can ensure equity of learning. In the case of remote instruction, there is an expectation for substantial interaction daily between the teachers and the students. So students will be expected to check in and be in classes when they're, contacted by their teachers with their schedules. Attendance will be taken daily regardless of remote or in-person instruction as per New York State Department of Education policy. That's really important. We will be using Google Meet and Zoom to provide video lessons and conferencing with teachers. That would be in addition to our Google Classroom. Students who are not in attendance will be contacted by the school in order to ensure their well-being and to provide any support that's necessary. If a student chooses remote learning, they must remain on remote learning until their home district timeline allows for return. Current remote instruction plans continue to be developed. We're working on those and we will communicate those with you as they come along. Also, if you have not had the chance yet to let us know if you have decided on remote learning or in-person learning, we ask that you contact us. If we have not been able to get in touch with you, we did send a letter home, which you should have received either today or tomorrow, I would most likely think. And if you could let us know, that would give us the information we need in order to make sure that we're providing your child with the instruction that they need.
Okay, it looks like it's time for some questions. So again, we've covered a lot in a relatively short amount of time, so we want to give you some time to process that. So as I am reading some questions, I encourage you to think about questions that you may have or that might remain and put those in the Q&A. I'm going to get started with just a few of the questions that have been submitted so far. Again, it looks like we'll have time for more, so if you have questions, please feel free to put them in there right now. First question says, would a student be able to bring in their own cleaning products. So all the cleaning products that we are using in school have been approved by the CDC and Department of Health. And as this is COVID-19 related, that's very important that we have these cleaning products that are approved. Any personal cleaning products such as hand sanitizers, again, we will have that available to students in all of our instructional areas. So you don't have to worry about those not being available to our students while they're in school. Another question was related to transportation. So how will we know about transportation to and from school? So at this point, we're in contact with our district partners regularly. So that's the different transportation directors within the school districts and our administrative partners on the scheduling of buses. You can imagine that that's a big ask for districts to coordinate all of that. But districts are working to ensure that students will have transportation to us all 5 days during the week. So you should be hearing more from your district regarding their transportation plans. But please let us know if you don't receive that or you have any questions, and we can help facilitate any answers to those questions with the district. Okay. A question about transportation: does social distancing need to happen on the bus? And the answer is yes. So social distancing needs to be maintained on the bus. So districts are working through their plans for transportation on number of students that can be on a bus, and then like for various programs that they do. Next question: what is a timely manner in which to pick up the student? So we mentioned that if a student is exhibiting symptoms, that you would receive a call from the school nurse and would be asked to pick up the student in a timely manner. So the question goes on to say a lot of parents work throughout the day. So what if a parent could not make it in a timely manner? We absolutely understand some of the hardships around students being in school and then parents working. So that's why we're giving you a little bit of time to maybe plan ahead and think about maybe there's some other contacts that might not currently be on the contact list that you could add and approve for picking up a child. But really, it is important that if you get a phone call from the school saying your child's exhibiting symptoms, that they are picked up in a timely manner, whatever that might be, as quick as possible, so that they, we limit the spread of germs, and it's the most safe option for them and for others. Next question: when will students get a list of supplies for school? So Ms. Bean, I don't know if you want to take that.
So our supply list will be coming with our welcome back letter and materials, which I would think would be going out within about a week. So that would be in that packet of material.
And the number of supplies that would need to be for school would be very limited. We're not expecting a lot of supplies to come in. Another question here that came in: how will exposure be handled? So I'm guessing what that means is if a student tests positive or is showing symptoms, what does that mean for other students and our building in general? So I kind of got into this earlier, but if a student tests positive, we're going to work hand in hand with the Department of Health, and they will really guide the decision making in terms of contact tracing. Of course, we will support their efforts in contact tracing, which is why it's important for us to take attendance daily and have a set student schedule. Those contact tracing efforts will include interviews and identifying those who might have to serve that 14-day quarantine. In terms of school, the health department will determine whether or not we close the building or not. That would not necessarily be just up to us. We work, very closely with the Department of Health in those situations. So at this time, I do not see any other questions coming in. So take a moment and think if you have any more, and please put those in the Q&A feature at the bottom. While you're thinking, if you access this presentation later on through our website, either the slides here or our video replay, and you do have a question that you might not have thought of during this webinar, I encourage you to reach directly out to the school. Mrs. Bean would be happy to discuss any questions that you have. Or if you have a question that might be particular to your student situation, please feel free to reach out as well. Not seeing any questions, we'll just give it another minute here or two. Another question just came in. What will students do about lunch? If we bring our own lunch, how will that be handled? So there will be a process for serving lunch. Of course, we will maintain the distancing. During the serving of lunch, students will be eating in a socially distanced classroom, so they wouldn't all be gathered necessarily as normal in a large cafeteria setting. So they'll have alternate place to eat their lunch. Students can bring their own lunch, but we just ask that they keep it with them and in their own kind of 6-foot bubble throughout the day. But they will be able to bring their own lunch. Mrs. Bean, do you have anything to add on that in terms of specific planning around the building?
So this will actually hopefully be the first year that we offer hot lunch also, which we have our new cafeteria equipment in. So students would also have access to hot lunch, which we would provide, and we would socially distance going into the cafeteria to get the lunch into the kitchen area and then return to the classroom where they're assigned to eat lunch. And in the morning, they would also get breakfast, which they would be considered a grab and go breakfast, and they would get that and go immediately to their first period class, where they would have lunch or breakfast in their area there.
Thank you. As I'm not seeing any other questions at this time, if we wanted to go to our next slide. So lastly, we just wanted to say that it's important for us to remain connected, not only as the school year approaches, but as the school year begins. So we're just asking you to please contact the school if you have any questions. If you need to update that contact information so we can best reach you as needed, or if you have yet to confirm in-person or remote instruction choice. As Mrs. Bean said, she sent home a letter in the mail this week, and that is if we have not heard from you or you're undecided at this time, we're going to ask that you please notify the school by giving us a call by August 26th. And that's really important because it allows us the time needed in order to plan our enrollment for in-person and for remote instruction. So it really helps guide our work as we plan for the coming school year. I would like just to end by saying, we miss you. We miss seeing our kids daily, and we're excited about the opportunity to see you. That's why we're all here, is to see kids and help them grow. And we will do that no matter the situation. But we're really encouraged by the opportunity to see you in the upcoming weeks and start our school year on a very positive note. Mrs. Bean, do you have anything else to add?
I would reiterate what you just said, Mr. Comtois. I look forward to having the students back. It's been very quiet here the past few months, and I look forward to seeing the students again. And I have a lot of faith that we'll work together to make this a good experience. And please do contact me if you have any questions. I'm available anytime.
So thank you once again for your participation. We really appreciate it, and we hope to see you very soon. Thank you.